Hi, I'm Dr. Samir Hajariwala, Clinic Director of Crossroads Chiropractic. I just wanted to take a couple of minutes and talk to you a little bit about pregnancy. So congratulations if you or somebody you know is pregnant. So the big question is always, how can chiropractic help with your pregnancy? So one of the leading symptoms of pregnancy is low back pain. You can also have a plethora of other things going on like sciatica, you can have carpal tunnel symptoms, but let's talk about just general low back pain for a minute. Now, when you're pregnant, as you get further along in your pregnancy, and we look at the spine over here, one of the things that occurs is the SI joints over here get a little bit wider to make room for the birth for the baby. So what happens is there's a ligament in here that just stretches over a period of time to make room. Now, as it stretches, these muscles that surround the spine here also get really tight and irritated. So we have an inflamed joint and tight muscles that are occurring. And during pregnancy, you're pretty limited with options of what kind of medications you could take, what kind of medications your OBGYN can prescribe to you. So alternatively, as a chiropractor, what we want to do is mobilize the spine, mobilize these joints in a gentle fashion to relieve that tension off the nerves, off the joints and ligaments. So to do that, if you're able to, I have you lay down on your stomach. Now there's going to be a period of time where you can't lay on your stomach. You're that far along in your pregnancy. So in the beginning, as you can lay on your stomach, I'm going to gently palpate the spine, see what areas are stuck or restricted. Those are the areas that we're going to manipulate. When I say manipulate, it's a gentle process that keeps both you and the unborn baby out of harm's way. So I palpate the area, see what areas need to move to relieve that tension. I'll have you lay down on your side and gently mobilize the spine, trying to relieve that tension. As we do that, it affects how the nerves fire and gets the surrounding musculature to relax. Alternatively, if you're not comfortable with a manual manipulation, I have different instruments that I can use either in the prone position as you're laying down, or if you're in the seated position, to try and gently move these joints, because joint movement is very necessary to relieve that tension. Now, other things that can occur, like I said, sciatica, that's another very common symptom of pregnancy. What happens is you have nerves in the low back that join together to form the sciatic nerve. When you have sciatica, true sciatica, you have an irritation of those nerves that travels down the back of your leg all the way down towards your foot. You can experience numbness, tingling, a burning sensation. And again, as a pregnant patient, your options as far as pain management are kind of limited. So what we'll try and do is mobilize the area and loosen up the soft tissue surrounding the sciatic nerve to try and take pressure off that. Now, in addition to chiropractic care, over here at the office, I have a licensed massage therapist who specializes also in pregnancy massage. So that's another option. The other thing you can try and do is just at home. A lot of people ask me, do I use ice or heat? I tend to go with ice. If you have a joint that's highly inflamed, if you have sciatica, pain going down the back of your leg, we need to cool down that inflammation with the ice pack. Heat is going to feel good for a little while because your muscles are really tight. But the problem is, as you add heat, it makes the inflammatory process grow. It's like putting gasoline on a fire. It's rarely a good idea. So if we put ice over here, it calms it down. And then as a result, your muscles will also start loosening up. Some people have a hard time with the ice, so then we go with a combination. Sometimes I'll tell you, let's do a period of 10 minutes of ice, followed by 10 minutes of heat, wait about an hour, and then we can do it again. So combining chiropractic care along with some of these home care issues can help you along the way. I'll typically treat somebody anywhere from 2 to 3 times a week in the beginning to help set the pace and make sure that your body is doing what it needs to do during its pregnancy. And then I'll taper you down to somewhere between 1 or 2 times a week. It all depends on the person. So if you have any questions at all about pregnancy, or how I can help you along with your pregnancy, give me a call, 770-252-1848. Look forward to seeing you soon.